Hello and welcome to episode 47 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is rehab versus lumbar spinal fusion for low back pain. Comparing rehab to surgery has been something I've been promoting for quite some time. And it's always fun to share some evidence on this to show that surgery truly is rarely needed. Sometimes it is, but it's rarely needed. And a lot of the United States and many other countries have kind of just been raised to think, oh, back pain, you get surgery. Shoulder pain, surgery. Knee pain, surgery. Especially with low back pain, right? Oh, a disc. What? Nothing can fix a disc. Only surgery can, right? No, that's absolutely false. That is absolutely false. And we have so much evidence to support it. And I'm going to share a little bit of that today. If you missed episode 46, I discussed the awful topic of degenerative disc disease and why I hate that word so much and why it truly makes no sense, and how if you have ever been told that you have that, you should listen to that podcast, because it will really help put some things into perspective and just show how silly that term is and why really you should not be afraid of it at all, and how it truly just means nothing. So go listen to episode 46. I really encourage you to, because I think you could help a lot of people just with the information you will learn from that. But today's topic is rehab versus lumbar fusion. For disc pain specifically, most of my clients that come to me have been offered disc surgery. This is usually in the form of a microdiscectomy. A microdiscectomy is where they will go in there and kind of remove the part of the disc that is bulging out into the canal. That might be pushing on the nerve. They kind of cut that portion of the disc out. The other common one is a lumbar fusion, where they will actually fuse the segments together through some rods and screws or some plates. That's kind of the idea. They're not allowing them to move. So let's say you have an L4, L5 disc herniation. They might fuse L4 to L5 so that that middle segment is not able to move. It is locked into place. Some of my clients have had laminectomies. Those are a little bit more involved. But for the most part, microdiscectomy and fusions are the most common procedures for discogenic back pain. Now, I have had multiple clients who have underwent these procedures and did not achieve relief. They did not get improvement from them. Most the time, they relapse within 2 years. Within that 1 to 2 year mark, it just comes back. Sometimes it's the exact same. Sometimes the leg symptoms, the sciatic symptoms are a little bit improved, but still that low back is locked up and it does not feel great. And simply because surgery rarely works. On the higher end, it is a 40% failure rate. 40% failure rate. That's not great. And once again, if you have movement issues, if you have habit issues, education issues, your low back is restricted and there's things that you need to do to improve that, a surgery will do none of that for you. It will do absolutely none of it. So let me cut to the chase. The article we're discussing today from 2014, the title is Lumbar Fusion versus Non-Operative Management for Treatment of Discogenic Low Back Pain. A systemized review and meta-analysis of randomized controlled trials. So this took into account quite a bit of data. So I'll just basically jump right to the results, okay? A total of 707 patients were divided into lumbar fusion, which were 523 of them, and conservative management. So a physical therapy program, a properly structured rehab program, 134. All right. Throughout those, they puoled all the outcomes. Their main way to track progress was the ODI, the Oswestry Disability Index, which is just an outcome questionnaire, an outcome assessment form. You might have heard of these. You might have filled one out at your doctor. How are you feeling today? What are you able to do? What is this troubling? And then you fill it out again in maybe a month or two to see, oh, hey, look, your answers are better, your pain scale is better, that sort of thing. Okay. So, the conclusion. It is unclear that the differences in the Oswestry Disability Index between the two, between the fusion, between the physical therapy group, would have any clinical significant difference. So, what this means is that there was no clinically significant difference between the outcome of the non-operative group, the physical therapy group, and the fusion group. Okay? They both produced favorable outcomes. And until further evidence is investigated, for the time being, both remain highly acceptable treatment methods for discogenic low back pain. So my question to you is this. In many times, there will be temporary relief, especially if someone is having disc referral or nerve referral down the leg. Most people that I talk to, I'm being very, very honest here, they will get immediate relief from that sciatica. They will, very commonly. But within that 2 years, it usually comes back, okay? Because whatever that person is doing, or whatever the root of the issue was not taken care of, because you can't fix anything like that with surgery. It doesn't exist. It doesn't work that way. So if you had the option of undergoing a lumbar spine fusion where they are putting rods and screws in your spine, they are essentially, stapling two of your vertebra or more together so they cannot move, and it is stuck like that for the rest of your life. And this procedure, obviously there's risks with any procedure. Anytime you go under, there's risks involved, right? And there might be multi-$1,000s involved as well. Or you could undergo a proper rehab program. And let's just say you get the same outcome, at least in the short term, same outcome in the short term. Which one would you choose? Rehab, obviously. Skip all the risk, skip all the hassle. A lot of people just don't want, knives and stuff in their spines, right? No, sometimes it's necessary. I'm not sitting here trying to say surgery is the devil. I'm not saying that. Sometimes it is necessary. I have sent some of my clients to surgery before. I have, okay? Very rare basis, very, very rare basis, but I have, okay? But for the most part, not many of us want our body being operated on if it doesn't have to be. So if you can avoid that just by doing a proper rehab program, who wouldn't do that? Who wouldn't do that? Okay? It's a no-brainer. And then especially in the long run, if you've gone through a structured rehab plan and you have learned, hey, I can use this exercise for this part of my spine, this exercise for my glutes, this exercise for my hips, this exercise for my mid-back, this exercise for my core. I know how to deadlift better. I know how to squat better. I know how to hinge properly. I know how to lunge now. You'll get all those benefits from a properly structured rehab program. You'll get none of those from a surgery. So in the short term, yes, individuals typically will get short-term relief in the immediate outcome of a surgery. But within those first 2 years, that tends to be when I see people regress, okay? But with that rehab, that's information you can carry with you for life. You will never lose that information. That information is in your brain. You get to carry that with you for the rest of your life to not only keep your low back healthy, but to keep all the other areas healthy too. Your mid back, your hips, your glutes, your core. You're improving everything about your body. And that lasts long term. Surgery, short term. Education for life. Okay? So even though I would tend to be a little bit biased just based on my personal experience, I would say, although this study is saying there's no significant difference between their outcomes, I would say, yeah, maybe right now, but let's look again 5 years from now. I would be willing to put my money on the fact that most of these individuals that had the fusion have regressed. And most of the people that did rehab, if they're committed people, did not. That's where I'd put my money. But let's just pretend once again, it's the exact same outcome. The exact same outcome, the exact same price. Say it's $5,000 for the surgery, $5,000 for the rehab program, right? If you're getting relief from both of them, obviously that's well spent money. I know people who have spent $80,000, $100,000 to improve their back, and if they could find a fix, man, they'd be willing to bet it all. Okay, so $5,000 fix your back, yeah, all day long. So even if the outcome was the exact same, still, would you rather get operated on and put under and have your body cut on, or would you rather not? I would rather not, right? I would rather not. I would rather not go through that, even if the outcome is the exact same. No, let's avoid that. Let's keep things as natural as we can, okay? And learn throughout the process. So even more evidence to support the fact that you can and you will recover with the right rehab. You can avoid surgery. So many of my clients were scheduled for a surgery and they were able to cancel it during my program, during our coaching together. And I feel so honored to be able to say that. I've probably had hundreds of surgeries canceled at this point due to me. I might be making some surgeons a little bit annoyed. Sorry, man. I hate to take some income from you, but it's an honor to be able to do that. And I feel very prideful in being able to say that. I'm very proud because I care about helping people the right way. And it's fun. It's a lot of fun to cancel a surgery. It's so great. It's so great to get those messages. Hey, Grant, officially, called the doctor's office, had them take me off the schedule. I don't need it. That feels really, really good. And I take a lot of personal pride in that because I'm passionate about this and it makes me feel good. I enjoy helping my clients. I enjoy having those conversations. It truly is a blast. So if you've been told you need surgery, if you've been told to consider these things, that rehab won't work, if you have a disc, surgery is the only thing that can fix it, it's a lie. It's a lie. And I'd be honored to help you through that process to find the right answers, to find the right plan. I work with people all over the world, right? Every continent, I'm working with somebody and helping them put these pieces together so that you can gain the education, so that you can keep these changes for life, so you can avoid the surgery, so you can avoid the potential side effects, adverse reactions from that, and you can have a solution that will be sustainable for the rest of your life and will benefit your overall quality of life in all areas of your body too for the rest of your life. Submit an application on my website. I'll be honored to learn more about your story and how we can be a team throughout this process. If you are listening on a podcast format, please leave a 5-star rating and review on Apple. I do believe Spotify will be releasing the option to rate as well, so keep an eye out for that. It does help grow the podcast. If you're watching on YouTube, please leave a like, comment, and subscribe for the YouTube algorithm. Move more, move in nature, and move in the sun. And as always, thank you so much for listening, and have a great day.